Hey everyone, welcome to the first video of the Paramedication series on the HelpEM channel. Throughout this series, we will be taking a look at the medications most commonly carried on an ambulance in the United States. We will be looking at these medications specifically from the paramedic's perspective, and we will be focusing in on the high-yield aspects of each medication you need to know for your NRP exam. So let's get started. The first medication that we will be discussing in this series is adenosine. Now, what is adenosine? Adenosine is a purine nucleoside with properties which make it a class 5 antiarrhythmic. Adenosine demonstrates these antiarrhythmic effects by interacting with adenosine 1 receptors on the myocardium as well as in the SA and AV nodes. Now, activation of these A1 receptors in the heart allows for more potassium to move out of the cell and less calcium to come into the cell. Now, that was a whole lot of nerd talk right there. So what does that even mean? The action of adenosine within the heart results in suppression of the action potential, hyperpolarization of the cell, and prolongation of the AV refractory period. This hyperpolarization is transient, however, as adenosine has a short half-life of approximately 10 seconds. So hopefully it's starting to make a little bit more sense now. With all of that in mind, it becomes easier to see why adenosine is the medication of choice for the treatment of acute supraventricular tachycardia and can also be used in the diagnosis of rapid atrial rhythms. Pausing conduction in the heart allows for opportunity for normal pacemaker activity to resume. So what does it do? By stopping conduction, you can slow down the heart. Let's talk side effects. Side effects of adenosine medication administration include chest pain, shortness of breath, flushing, headache, syncope, a feeling of impending doom, and a terrifying period of asystole observed on your ECG monitor. Now how about some dosing? The dosing schedule of adenosine in the 2015 AHA guidelines is 6 milligrams given in a proximal large bore IV site followed by a flush of at least 20 milliliters of normal saline. If conversion of the rhythm is not successful, it may be followed up with a 12 milligram dose, again, followed by a normal saline bolus. A third 12 milligram dose may be administered if still unsuccessful. Historically, this medication is given using a 3-way stopcock, but recently, a 20 cc syringe has become a little bit more popular. I'll post a link to that video in the description. How about some other things you may need to know? Now these would be test questions. Adenosine is a pregnancy class C medication, meaning that it may be safe for use in pregnancy. How about some times that you may not want to give it? Adenosine may be contraindicated in asthmatic patients, heart failure patients, second or third degree heart block patients, and patients with severe hypotension, where you may want to consider cardioversion. So there you have it. I hope you found this video informational and helpful. If you have any further questions, send an email to the HelpEM channel at gmail.com. Thanks for watching.